Welcome to the show. I am the Chief Exceptional Officer at DAS HR Consulting, specializing in human resources and diversity programs and services for small to mid-sized companies. We create non-traditional and unique programs to fit your company goals and objectives. We have been in business for 13 years with clients in various industries. This is CEO Interviews with Dr. Di. Welcome to the show. So glad to have you. Of course, I love doing these videos and webcasts. I get the great fortune of interviewing today Dr. Brian Dixon. He's the CEO of Mindful and Simply Psych. So welcome to the show, Dr. Brian.
Thank you so much for having me, Dr. Di. It's good to be here.
Great. So you're the CEO of two companies.
Yes.
Which is awesome. So tell us about both of the companies and what their vision is.
Yeah, so Mindful is a direct practice company. So I work directly with patients. As a psychiatrist, I get to work directly with patients to help them feel better. So that's the first company. And then out of that company, I grew Simply Psych, which is a practice management company. It's where I learned all the mistakes in running my own business, and then I put them in their own company.
Wow. Yeah. So tell us about your, I know you can't talk a lot about the practice of who and what, but tell us a little bit about what you do in Mindful.
Yes.
Like the type of clients that you serve, and then Simply Psych as well.
Yeah, perfect. So in Mindful, so I'm a psychiatrist and I get to work directly with patients. And so my youngest is 3, my oldest is like 75. So, and we treat basically everything, any type of depression, anxiety, those sorts of things. And so I'm the owner, but I also work in the company. So I'm employed in my own company. And then I run Simply Psych, which manages the practice. So all of the HR stuff that you are so well versed in, I get to know a little bit about. I dibble and dabble, if you will, and I get to work with employees and make sure that our staffing, our scheduling, our financials, that's what Simply Psych does, both for my practice as well as other therapist groups.
Oh, so you are a consultant to other therapists.
In a sense, yes. And the good thing is I know my limits, and so anytime I have a really difficult HR question, I reach out to professionals like you.
Oh, yeah. Well, great. So tell us how many employees you have. And what the challenges are for recruiting and retention.
Yeah. So in Mindful, there are 4 doctors. So it's a physician-owned company as a professional association in the state of Texas. And then Simply Psych is a PLLC, and we have a total of 6 employees. And that's one of the challenges. So finding employees, especially in this marketplace where there are jobs galore, is really, really difficult. The other problem is, it's really tough to retain folks if, as a small business, we don't have all the 401ks and the health insurance perks to try to keep people invested in this particular job. And so we spend a lot of time on culture. We really want an inclusive culture where people feel valued and heard, and it's daunting. I spend a lot of time on social media trying to find people.
Well, great to have you, because this is going on in social media. So are they all doctors?
Not all doctors. So some doctors over in the company known as Mindful, those are all doctors. In Simply Psych, it's everybody. We've recruited folks from the hospitality industry. We've recruited folks from the medical practice industry. Some folks were fresh out of college and just learning how to write newsletters and communication. So it's a big mix of people.
So tell us about your education, because I know in Texas, it's very hard to find psychiatrists.
Correct.
You can find psychologists.
Correct.
So you can talk a little bit about the difference, which helps all of us to understand.
Yeah.
That type of difference.
Yeah, so the difference, so both psychologists and psychiatrists go to a 4-year college of their choosing. And then that's where they split. Psychologists go to graduate school for 3 to 7 years, depending on what type of degree they want, either a PhD or a PsyD. And then doctors go to medical school, so they'll spend another 4 years for that. And then for psychiatry, you have to do an additional 4 to 5 years to be a psychiatrist. So it's about a 12 to 13 year investment. And unfortunately, they don't teach you how to be a CEO at any point. And so I came out of residency going, hey, I want to start my own practice, but I have no idea how to run a business. And so I just made it up as I went along.
So there is no how to be a business owner, because most of your compatriots in the industry have their own practice.
Correct. Yeah. So most of them are employed. They will go and work for a big health system, that sort of thing. So as a result, there are very few of us in private practice, which makes it so hard to find a psychiatrist. Yeah.
Oh, I see.
Yeah.
So most psychiatrists do have their own business, or do they work for hospitals?
They work for hospitals. So, and that's another, and this is why I love being on this podcast, because you concentrate on small to medium businesses. Well, they work for the bigger systems because they offer all those perks. And so that's where I have to work twice as hard as a CEO to recruit people out of those health systems. And the way that I do it currently is I make sure that they feel heard. All of my employees feel heard and valued. We compensate, I think, very fairly. And then I try to empower them. So that's part of that retention part. I want to empower them to make changes in their job that they feel are meaningful and worthwhile.
Do you provide health care?
So strangely enough, it is prohibitively expensive for me to provide health insurance to my employees, and so we bump our wages up. We actually give people more money so that if they want to buy a short-term plan, if they want to, most of my employees actually use their spouse's insurance, as strange as that sounds. So yeah, it's one of the hiccups of being a small business owner.
Wow, I know. So I mean, that's a challenge for all CEOs in small companies. So how do you learn about being a CEO? What kind of resources as a small business owner do you try to find to understand how to run your business?
Yeah, networking has been the most helpful. So I've talked to other entrepreneurs and said, I don't know what I'm doing. How do y'all do it? And then I've hired business coaching, I've hired consultants, lawyers, that sort of thing. And the key for me, and the thing that I would tell everybody that's listening to this podcast as a CEO, is hire good people. I made the worst mistakes because I thought, oh, I can just do it myself. I'm a doctor, I can just figure it out. No, ma'am, that is not how this works. Hire good people to make sure that you get good processes that are ironclad. And that has been the most helpful piece of advice I've ever gotten.
Wow. So what do you plan for your business? Do you want to grow? You have 9 employees, right? What's your vision, future vision for the next 3 years?
Yeah, so the big vision, the 20-year vision, is that everybody can find their therapist. I always tell folks, everybody deserves a good therapist. And so that's the overall vision. The way that we make that happen is that those therapists are really good at doing patient care, but most of them are not good at the back office stuff. The calling, the phone calling, the scheduling, rescheduling, managing all of your social media and your marketing and that sort of thing, and HR. And so I want to be that company that provides that back office support for therapists. And that way, everybody can find a therapist because the therapist will be able to be found. And then the therapist can give those patients their undivided attention. So the next 3-year plan is to really, really, really find good people so that we can scale. And it's daunting, but I'm looking forward to the challenge.
So you're in Fort Worth.
I'm in Fort Worth.
You're in Fort Worth, which we have very few psychiatrists.
That's correct.
Do you plan to grow into Dallas?
Yes.
And I don't know what the market is in Dallas. I'm sure you've done some research. And expand into other places in Texas.
So just a bit of some data. So for example, child psychiatrist. So I'm a child psychiatrist. I get to work with kids and adults. I think there's 20 million people in Texas. I think probably more. And there are 630 child psychiatrists for all of Texas. That's how dire the need is.
Oh my
Yeah, and
gosh.
so part of my goal in expanding statewide is to make it more attractive to pull other child psychiatrists from other states. It's a competitive market, y'all. And so I want them to move to Texas, because once you're in Texas, especially with telemedicine, you can then contact all the counties in Texas through telemedicine, but you have to be in the state first. And so one of the market things that I'm hoping to do is recruit psychiatrists, child psychiatrists, and adult psychiatrists from other states, get them here in Texas, support them, help them feel loved and appreciated,
Right.
and then through that, they can go out and work with as many people as possible. So that's kind of the two-layer step.
Wow, that's a great goal. So when they get out of med school,
Correct.
do they usually go back to their home state?
Ooh, yeah, so that's a tricky one. And this is one of those, where you go to med school, most people don't stick around there because you have to do that additional layer of training, which we call residency. And once you do your residency, you tend to stay where your residency is. And so I did my residency in Kentucky, and I literally thought about staying in Kentucky. I'm from Texas. But I needed to come back because the queso is much better here. So I just don't go to Kentucky and try to get queso. And my family's here. And so there is a movement afoot statewide to bring more residencies here, to create more, to have the hospitals create more residencies for psychiatry, so that then psychiatrists stay here. In the meantime, and that's a 3 to 5 year process, in the meantime, we need to recruit them from outside. And so that's why my goal is recruitment.
So I understand there's not a lot of child psychiatry in the state of Texas. Is that true?
It is. And so, unfortunately, it takes an extra year of training to become a child psychiatrist. So, in order to be a child psychiatrist, you have to be a board certified adult psychiatrist first. And that's already 4 years of training. And then most times you have to add 1 to 2 more years. And the work of a child psychiatrist is really challenging, because you don't just have one patient. You have the patient and the parent, and then the relationship between the two. So you're actually doing 3 times the work in the same amount of time. And a lot of people are like, yeah, I want to focus just on adults, and they go into adult psychiatry. And so that makes the shortage even worse.
So, Dr. Brian, how about the diversity of your patients, particularly COVID? It affected children and adults. Talk about the diversity of the patients, and then the diversity of your psychiatrist in your practice.
Yeah, so the diversity of our patients, so depending on what level of care you're in, so I'm an outpatient, which means someone will see me maybe once a month to once every 6 months. And my current kind of mix right now, I'd say 20 to 30% are people of color, either adults or kids. And that was pre-COVID. After COVID happened, I would say it's probably dwindled a little bit, so maybe 15 to 20%, and I'm not exactly sure why. Now, there are other ways of getting into psychiatry, either hospital systems and that sort of thing, community networks. And so I'm sure their demographics are what they are. But it is a challenge because good healthcare costs money. And so it's this mix of trying to figure out insurance and not insurance, how to reach people. Sometimes you need to do Google ads, or sometimes you need to send out mailers, and all that stuff just costs a lot of money. And as a small business, it's really tough to compete with the big corporate folks when it comes to money and marketing.
How about the diversity of your staff?
Yeah, so I am very deliberate in going out and making sure that my staff looks like the population that we serve and the population as a whole. It is a challenge. It's almost like kind of like a DEI tax, because I have to spend countless hours, additional hours, to try to find Latinx and African American doctors, staff members, physician assistants. It's really, really tough. So right now, I don't know all the demographics, but I'd say we're 50% women and men, and then we have I'd say probably 25% minority in both companies combined.
So back to my question, do you plan to do Dallas? How about Austin,
Yeah,
since it's so limited. I mean,
is.
682 psychiatrists?
Something like that. Yeah, it's less than 700 child psychiatrists for all of Texas.
Oh, okay.
Adult psychiatrists, I want to say there's maybe 1,400, I think, is what
That's still low
which
for
is still
the
super.
population.
Correct. And so, yes, we will expand, but COVID taught us something very powerful when it comes to real estate. So when I leased office space, and then we couldn't use it because you couldn't have face-to-face visits. It was really tough on the bottom line. There was some touch and go moments there, and so we're having to pivot and incorporate more of that telemedicine experience. Well, now that we've done it, now that we have that infrastructure in our company, we can now expand to anywhere. And so even if I have my doctors here, they can reach down to Houston, they can reach out to the Valley, they can reach out to El Paso, that sort of thing. It's just building that internal infrastructure to make it work. And I'm looking forward to it, but we just need more people. So I'm actively looking for more psychiatrists, especially those who can speak Spanish, because we don't have anybody on staff who can speak Spanish.
And that's a challenge.
It totally is.
And it's not just in your industry, it's in other industries. Construction is pretty good, but when you go out to the professionals, it's just a challenge for all of us.
Yeah.
Wow, that's amazing. What an education for my audience about this kind of industry. And so, do you see telemedicine continuing? I think because we keep getting these phases of COVID, and I call all of them super COVID or all of that. So do you see that happening more and more?
Correct. Telemedicine and telepresence will be a staple from now until forever. And in a sense, I think it's kind of a good thing. It's a business opportunity, number one, but it's also an individualized approach to healthcare. And so I think that soon everybody will have their doctor in their pocket, their psychiatrist in their pocket, their fitness person in their pocket. Now, managing all that background, all the folks who are on the other side and all the HIPAA compliance and all that, that's an HR nightmare. So good luck to you. Peace and blessings, because it's going to be tough to make sure that all of that stuff is compliant.
Oh, yes.
But yeah, I think telehealth is here to stay.
Wow. Well, I thank you, Dr. Brian, for being on my show and educating my audience and telling us all about this amazing businesses that you have. I am hoping and praying you expand, because our children and adults need psychiatrists and psychologists, and I know how difficult, because I'm a recruiter, my business does it. We try to find, as I told you, I have clients that are counseling companies, and trying to find counselors is just difficult. So thank you for educating us. I'm so glad you're here. Did you have any last words?
Yeah, so I always tell folks there is no such thing as crazy, okay? So no such thing as crazy. We as a society have been through a lot. Let's be kinder to ourselves. Spend some time breathing and relaxing, because we're under a lot of stress. So be kinder to yourself, be kinder to others, and we can build a better society.
Oh, well, thank you. I hope to have you back again.
I love that.
And thank you to Dr. Brian Dixon. He has a website. It's Simply Psych. So you can go out there, okay? And if you need a psychiatrist, He's got a great practice. So again, audience, thank you for viewing this podcast. And Dr. Brian, thank you for being here.